Hello, my name is Alex Serrano, a student at Azusa Pacific University. I will be role-playing a meeting with the Ways and Means Committee Chairman, Richard Neal, whose efforts recently passed the Bipartisan Prescription Drug STAR Act, H.R. 2113. It addresses key issues surrounding the rising cost of prescription medication, a national patient safety crisis. Good afternoon, Mr. Neal. My name is Alex Serrano, a registered nurse executive in the state of Massachusetts. On behalf of our organization, I want to thank you for taking the time to meet with me, and we appreciate the work you've done to keep our patients safe from the rising cost of prescription medication.
Thank you. It was a collaborative, bipartisan effort, but there's more work to be done.
Mr. Neal, we are working hard as an organization of healthcare professionals to help our patient constituents decrease the high price of prescription medication necessary to sustain life and prevent premature death. Together with the American Hospital Association, we are the Campaign for Sustainable Prescription Medication Pricing.
Tell me more. I'd like to learn and fully understand what you're trying to achieve.
I'm here to tell you about the work we do to protect our patients from the rising cost of prescription medication. We help save lives by partnering with hospitals across the nation to have physicians and pharmacists alike offer low-cost generic alternatives. Second, we educate the public about pharmaceutical pricing practices to create awareness. Last, we research and propose policy to strategically address the rising cost of life-sustaining prescription medications. For example, insulin has a list price of $400 per vial. Conservatively, this amounts to over $2,000 for 1 month of treatment. People need these medications to stay alive, and many are not adequately covered by healthcare insurance to cover the cost. Those affected are losing everything to help pay for their treatment, and some who cannot afford it are dying prematurely. The nation is facing healthcare insurance uncertainty, and as it stands, some insurance providers force patients to pay thousands in deductibles before they begin to cover the cost of medication. People should not be forced into an economic disaster just to pay for life-sustaining treatment.
Your work to help protect our constituents is admirable, and I was not fully aware of this emerging situation.
Yes, Mr. Neal. For example, Jane Robinson is a 37-year-old female with insulin-dependent diabetes who lost her job, sold all of her possessions, including her home, just to pay for insulin. She was facing death without her medication. She had no other option but to leave Massachusetts in order to find a job that offered adequate healthcare insurance to cover the cost of insulin. I tell you this story because there is no generic low-cost alternative for her type of insulin, which is the same for millions of other constituents.
This is very unfortunate. How can we help?
Our organization is ready to present your committee the alarming urgency involved with the rising cost of insulin and propose policy recommendations before your committee. If that is not possible, we would appreciate your visit to our headquarters program to hear more from other healthcare professionals like myself and constituent supporters on this emergent life-threatening concern.
I see that one of our topic-specific hearings may not be possible at this time. However, I would love to learn more about your campaign efforts and policy recommendations with a site visit.
That is very good news. I will personally send your designee multiple dates for your convenience. Here is a one-page summary of our campaign specifics and contacts. Would it be possible to visit us in the next 2 months?
It is possible. I'm very interested in your program. Sally will provide you with specific contacts, and we will be in touch very soon.
Thank you so much for your time and support. We look forward to your visit.